So today we're talking about how to track ovulation properly, right? Properly. So if you're there, you're ready for this discussion, please type in the comment section ready so that I know that we are together. Just type ready, then we'll begin. If you are with me, right? Anyway, I usually just need only one person to listen to me because that is where my fulfillment is. Just one person, right? All right. Ready. Let's go. Esther Goliath. Really? Esther Goliath, how are you? Good to see you. If you're still here, just good to see you. You're welcome. All right. So we're discussing how to track ovulation properly. And this is one thing many people uh, really needs to learn, especially those who have irregular irregular menstruation. The fiberglass is here. Right? Many couples believe that they are trying at the right time because they are having regular intercourse. Right? I blame them because is it not us that say have regular intercourse? So they believe they are trying at the time because they have regular intercourse. But in fertility medicine, your timing is everything. When it comes to reproductive biology, timing is everything. You can be perfectly healthy and have normal sperm or healthy sperm, normal hormones, and still not conceive if your intercourse is not happening during the correct window. So, normal hormone levels, normal and healthy sperm, every test, fertility test is normal. But if you are not trying at the right time or the correct window, you're just wasting your time. Why? Because ovulation tracking is not just about guessing or counting days, right? It's about understanding your body's rhythm, which is not the same for everybody. It's about identifying the fertile window and using reliable methods to confirm when the ovulation is approaching or has occurred. And these are the methods we're going to be sharing with you tonight. So you don't want to miss anything. And I also pray that network does not distort or disturb. Network should not disturb anybody. So if it's your village people that used to carry network, right? You want to beg village people, not now, not now, not now. Yeah, not now, people, because we need to learn something. We're going to discuss all the common methods of tracking ovulation. That is the discussion we have tonight. So we're going to expand it deeply and look into how ovulation is tracked. We're going to look at how to calculate ovulation for regular cycle, how to calculate ovulation for irregular cycles, and how to use both your home and medical methods for accurate timing. It's going to be a lot to learn tonight. So that's why you need to make sure you are undisturbed. Okay? My network is slow. I know. I'm looking at it here, but we'll we'll do our best to, to learn something tonight. I see you, Kadi. I'm seeing a lot of people. So if you're here, you want to follow me, and please comment in the comment section so that we can relate adequately. And if you're trying to conceive, don't go anywhere. Stay here because I give you between now and June. That belly, you go carry on, right? You carry that belly. So stick around. Be careful. All right. So the first thing I want to deal with is why ovulation tracking even matters in the first place. Why ovulation tracking matters. Why why should one track ovulation? Yeah, it's because a woman is fed for only a small portion of time for each cycle. She's not fertile throughout the month, throughout the days of her cycle. Just a small portion of time. Yeah. Biologically, um, eggs survive 12 to 24 hours after ovulation. So when ovulation occurs and the egg is available for 12 to 24 hours. Now that is short. So you don't say, "Oh, I've ovulated," so you're gonna be fertile until the next period. No, ma, it does not work like that. Yeah, 12 to 24 hours. That is when the egg survives. After which it's gone. Now, hold that information here. Now, sperm can survive up to 5 days inside the female reproductive organ. So that's to say, the nag where you nag 5 days ago, the sperm is still there in your reproductive organ, right? Right? Now hold on to that information still. Is that okay? So we have ovulation within 24 hours, sperm being available for 5 days in the female reproductive organ, right? Now, this means that pregnancy can only occur during 6 day window of your entire cycle. You see that? Pregnancy can only occur during 6 day window of your entire cycle. Why? Because 5 days before your ovulation, then the day of ovulation proper, that is 6 day window. Now, outside this, the chance of pregnancy is extremely low. You are less likely to conceive outside this 6 day window. So it doesn't matter how long your cycle is, duration of your cycle. Some people have 21 days, 24 days, 35 days, 8 days. It doesn't matter. You only have 6 day window for which you are fertile. Yeah. And if you are trying to conceive, that is a very veritable information for you to keep. You see, studies have shown that the highest probability of conception will occur 1 to 2 days before ovulation. So even though you know you have a 6 day window and you want to have a higher chance for conception to happen, right? 2 days, 1 or 2 days before the ovulation, fire, right? That's when you have a higher chance. And that's remarkable. Good evening, Christy LaBelle. Good to see you. You're welcome. How is your day? Right? So, the chance of pregnancy drops sharply after ovulation. Sugarberry. Sugarberry is here. Where have you been, Sugarberry? Where have you been? I've not seen you for a while. Or you are just passing or something. Even though I know the network is doing somehow. Right? I'm all right, Sugarberry. I'm all right. I'm all right. And by the way, I'm looking at your profile picture. It's looking all reddish. Is that Valentine? Is that Valentine? All right. So, I heard that Valentine is coming. God bless you if your ovulation comes in Valentine, right? All right. So where was I? Where was I in the gist? Oh boy. So let's understand the menstrual cycle first. Is that okay? Who is ready for the next part of the gist? If you're still here and you're ready, just type ready in the comment section. Let's understand the menstrual cycle. Yeah? Let's understand the menstrual cycle. I've talked about the fertile window. You want to hold on to that information. Thank you, UK for life. Thank you very much. I appreciate you. Thanks a lot. street street character. And that's what you heard. Yes. Yeah, I said if you know your fertile window, go and fire. Go and what fire. No mercy firing. Right? So fire on. and those of you who say you don't like sex, leave that stream. This live stream is not for you. If you are trying to conceive and you don't like sex, leave this live stream. It's not for you. Because we want people who produce result for us, right? Not people who. Right? How do we get results if you are doing your own thing? Don't try. Don't try. I'm telling you. All right. So, and by the way, if you are coming for the first time, you are seeing me for the first time, you want to follow me. You want to follow me. Follow me now. All right. All right. Let's talk about menstrual cycle. Is that okay? Let's have a clear understanding of what this thing is, so that we can now put everything in perspective. Is that okay? So before ovulation tracking, it's important you understand the structure of the menstrual cycle. Very key. A a typical cycle has three phases. What did I say? I said a typical cycle has three phases. And we'll talk about it one after the other and explain it in details so that we'll leave nobody in doubt. Is that okay? So the first phase we'll talk about is the what we call follicular phase. Don't worry about the name. I don't need you to remember the name. Just understand the concept. Is that okay? Just understand the concept. Right? And by the way, if you missed any episode from before, just go to YouTube, search the name Dr. Godwin EMB, and follow what I've said before because there's so much I've talked about. I cannot go back now. Is that okay? So the first phase in your menstrual cycle we want to talk about is the follicular phase. Yeah? And this phase begins on the first day of menstruation. So that day the menstruation starts, the menstrual bleeding starts. That is the first day of your menstruation. And when they ask you, when was your last menstruation, they actually ask you for that first day. Don't come and be telling me when it ended. Because that's what patients used to do to me every time. So please tell me the day starts. Right? So follicular phase begins on the first day of menstruation. Yeah? Now, what happens? I will not go with all the details because you are not. This I'm speaking to the general global audience. But if you are a student, you want to learn, come to my inbox. Then I will teach you all the principles and nitty gritty. Is that okay? But just information is for general audience. So basically what happens is that the brain is involved in all this matter. Remember what I said before anything happened down there, it all starts from here, whether you're a man or you're a woman. So that is the reason why, let me digress a little. That is the reason why when you offend an individual and you're trying to have a sexual advances as a person, the person will not respond. Why? Because it all starts from here. The offense is here. The reproductive response is here. So you have to appease the head before the remaining part will follow. Is that okay? So it starts from up. So in this phase, what happens is that the brain will release what you know as FSH, that is follicle stimulating hormone. Is that okay? And now that influences the ovary to prepare follicles that contains egg. So basically, that's the simplest way to put it for general audience, right? So the brain will release the hormone. That hormone will influence the ovary, and the ovary will begin to prepare egg for maturation and eventual release, right? And this phase will vary in length between women. It's not the same length for the same. Dr. Pat is here. You're welcome, right? The follicular phase is not the same length for every woman. It varies in length between women. Now, the next phase is the ovulatory phase. Ovulatory phase. And the phase is where when the hormone, that follicle stimulating hormone, keep on influencing follicle or egg preparation in the ovary, the follicle begin to mature until one of them, several of them will start, but one of them becomes more dominant. For those who have gone for follicular tracking before, that's basically what they are looking for. They're looking for the most dominant one or most dominant ones, right? So that leads us to the ovulatory phase. And now this ovulatory phase, the dominant follicle releases an egg. Follicle is like a structure that holds the egg, right? The egg is inside the follicle. So when the follicle mature, it ruptures and releases the egg. I hope that is clear. So this dominant follicle releases an egg. And this action is triggered by what you know as LH, what's it called, luteinizing hormone. For those of you who have done hormone profile, you've heard his names before, right? So that process is triggered by the LH surge. When all that happens, ovulation will occur. And now that is what happens every cycle. Every cycle. So these are the events that happen in the ovulatory phase. Is that okay? Now that leads us to the next phase, which is the luteal phase. Don't worry about the names if you cannot remember. Just remember the principle. Is that okay? If you're just joining, you're welcome. If you're not following me yet, you want to follow me now, follow me now. And yet, if you are trying to conceive, make sure you join the TTC League starting in April 1st. It's all for everybody who is trying to conceive, whether naturally or through IRT, right? And I'll talk about it more at the end of this, before I end the live stream about the TTC League. By June, many of you, your story will have changed. I tell you. So this whole thing from the ovulatory phase leads us to the next phase. Winnie Nandutu, I see you. Pray for my daughter, Connie. What's wrong with her? Talk to me. What's wrong with her? right? So luteal phase. Luteal phase, ovulation must have occurred. In fact, the moment ovulation occurs like this, that is the luteal phase we have entered, right? And that phase, progesterone rises. Hello, pretty. I see you. You're welcome. Right? So the moment ovulation takes place, luteal phase begins, and what you have is rise of progesterone. Progesterone rises. Yeah. And that rise in progesterone helps in preparing the uterine wall for implantation. Everything that happens in your body has a purpose. And we're talking about this today when I said if there is one misstep or um, problem in any of these stages or steps, forget about fertility, because they has to go step by step, process by process to achieve this one result, right? So the rise of progesterone will help to prepare the uterine lining for implantation. And now this phase is more stable and usually will last for 12 to 14 days in most women. Is that okay? Love girl, I see you. What I just said now is the key to calculating ovulation. This is the key to calculating ovulation, right? So if you understood anything up to this, please type in the comment section understand, right? If you did not understand, say you don't understand. If you are just coming, don't say anything because you did not hear anything, right? Now, if you have understood something, we should now go on to talk about how to calculate ovulation, starting with those that those that have regular cycle. So we want to talk about team regular. This is your time, right? I'm waiting to see who understood something. I don't understand. Was you know, okay. The distraction was your fault, so I'm not going to go back. Just make sure you find the video will drop in YouTube. Make sure you catch up with this live stream on YouTube. So just search the name Dr. Godwin EMB on YouTube and you can catch up. So just stick around. Pretty, is it Pretty that is asking a question? Stick around. We'll talk about everything. Is that okay? Then, if you still don't understand, you ask your questions. Then we'll see how to help you. Is that okay? All right. Okay. So, how to calculate ovulation for team regular? Team regular, this is your time. All right. When we're done with regular, we'll now talk about how to calculate ovulation for team irregular cycle. So you don't want to miss out. Edo Finest is here. All right. So this is what regular would mean. A regular cycle means period come at a predictable interval. Yeah. It means the cycle length is usually between 24 to 35 days. Yeah. It means if there is variation at all, it's less than 5 to 7 days each month. So if you have maybe your last month menstruation came so time, then this time around it's just 2 days difference, or the other time around it's 5 days. Don't worry, it's a normal variation. It's when it's beyond that. That's when you know. So, oh, this is my case. I've entered team irregular. right? That's when you know you have changed, you have deported from regular to team irregular. Is that Emda? Emda is here. Hello, Emda. How are you? Long story short, the most important rule, yeah, the most important rule, ovulation occurs about 14 days before the next period. Listen, listen. Ovulation occurs 14 days before. Keyword before. You want to bold it, underline it, uppercase it, right? Capitalize the words. Ovulation does what? Ovulation occurs 14 days before the next period. Did you hear anything? Please talk to me in the comment section. I want to be sure somebody heard this. So when we want to calculate your ovulation, let us know what's going on, right? Did you hear it? Just say I hear you so that I will know somebody's hearing me. Johnny Kev, okay, Johnny Kev heard me. All right. Ovulation occurs 14 days before the next period. So that's to say, regardless of how long your cycle is, right? It is not 14 days after the last period. It is not 14 days after. It's 14 days before. And this is one of the most common misunderstanding when it comes to ovulation. Now, and I know that can happen because this misunderstanding can happen because of the textbook cycle is usually 14 days. Is usually 28-day cycle, right? So if you want to calculate ovulation, you just divide it by 2. So that gives you a wrong perception of what ovulation is. But at least today we are clearing the air. And what did I say? Ovulation occurs 14 days before the next period, not 14 days after the last period. Understand? Not 14 days after. I'm trying to buttress it, right? If you know here and now, you go pay consultation for this information. Right? 14 days before the next period is your ovulation. Is that okay? Type I hear you in the comment section so that I'll be sure that somebody heard me. If one person heard it, that solves the whole problem I have. Right? Just say I hear you. Then let us work together and look at the step-by-step calculation method. Who is ready for this step-by-step calculation method? Because I'm going to also be needing your examples, right? I'm going to need your examples. So let's do step 1. Step 1 in this calculation method, you want to determine your cycle length. So if you are there, just give me your cycle length. Whatever it is, 31 days, 35 days, 21 days, 28 days. Your cycle length, give me. I'll just pick a random number so that I can do the calculation together. Is that okay? So step 1, determine your cycle length. 31 days, good. I'll take 31. Right? Now, count from day 1 of your period. That 31 days means day 1 of your period to day 1 of the next period. That is how you got 31. That is how you got the 28, 29 I'm seeing, right? Day 1 of your period to day 1 of the next period. Clear? So I said we're going to take the 31 as an example. That leads us to step 2. Step 2, subtract 14 days from 31. Somebody do the math. Let's estimate her ovulation date. Subtract 14 days from 31. So I will not do the maths. I want us to work together. Who is with me? Please make sure you are engaging in the comment section. Right? 14 days from 21. So her estimated ovulation day is the 17th day in a cycle. Right? It's the 17th day of a cycle. So if your cycle length is 24 days, for example, then your estimated ovulation day will be day 10. Why? Because you minus 14 out of it. If your cycle length is 26 days, minus 14 will be what? Day 12. If your cycle length is 28 days, minus 14 will be day 14. Somebody said something about that. All right. Thank you very much. Global Rosie. It used to be Uzi. Global Uzi is here. Thank you very much. That's my favorite grandma in Canada. Thank you very much for joining, ma'am. Right. So where was I? So if your cycle length is 30 days, what do? Minus 14. What does that give you? 16th day or day 16 of your cycle is the estimated ovulation day. What about 32 days cycle length? Day 18. What about 35 days cycle length? Day 21. Is that clear up until this point? Type in the comment section. Clear. Quincy, I think we've answered your 31 minus 14. That's 17, right? We've answered that. So that will be the estimated ovulation day will be 17th day. Clear. Now let's go to step 3. Right? Step 3. Is it so? So is here. Long time. Such a long time. I've not seen you. I know network has been doing a lot of shenanigans. That's why a lot of people have been dropping off here and there. But don't worry, we'll be good. Right? So let's go to step 3. Step 3. Step 3, often identify your ovulation day and calculated it correctly. I'm talking to Team Regular. If you're a Team Regular, just give me a wave in the comment section. Team Regular. Team Irregular, wait first. I will get to you later. But I want to talk to Team Regular. Are you there? Just wave me. Team Regular. Right? If you are there, just send me a wave, right? So step 3, Team Regular. What do? Haven't identified your ovulation or calculated your ovulation day. The next thing we want to do is to identify the fertile window. Identify the fertile window. And if you came earlier, you already know what the fertile window is. Right? For people who are just coming, because latecomers, there always a plenty for this thing. Right? MSEG is here. So for people who are just coming, the fertile window is 5 days before ovulation plus ovulation day. So that is 6 days of fertile window in your cycle. So if you have 31-day cycle, you only have a window of 6 days. If you have 28-day cycle, you only have a window of 6 days, right? Let's take another example. Let's take, I think somebody dropped 28 days cycle before the ovulation day. So for ovulation day is day 14. The fertile window will be what? Day 9 to day 14. Let's count it. Day 9, day 10, day 11, day 12, day 13, day 14. That is 6 days. Is that okay? The network is kind of slow, right? Are we understanding anything? Please talk to me if you're understanding something. The network is slow, so just stay with me. So if your cycle is 28-day cycle, your ovulation day is day 14. Your fertile window will be from day 9 to day 14. Is that okay? In this example, because you can use 35 days, do your mathematics to calculate your fertile window, right? So in this example, the best days of intercourse, the best days to knock waiting no good, right? Right. So the best day to knock waiting no good will be day 11, day 12, day 13, day 14 of your cycle. The best of the days is 1 to 2 days before ovulation. That's the best. The 6 days is good, but the best, among good, there is best. So the best is 1 to 2 days before ovulation. Is that clear? Is that clear? So if network throw you out of your live stream, please bring yourself back, because you cannot miss this information. So let's look at a practical example for team regular cycle, right? Let's say a woman has first day of her last period. Are we following the gist, right? The woman has the first day of her last period is January 1st. January 1st. Yeah. And her cycle length is 30 days. Right? 30 days is a cycle length. Please talk to me in the comment section. When will be our ovulation day? When will be our ovulation day? Our cycle is 30 days. That's pretty easy. We've talked about it, right? That is 30 minus 14. That will give us day 16. Day 16 is her ovulation day. Is that okay? Then, after you know your ovulation day, you now want to find out, when is my fertile window? Your fertile window will be 5 days before ovulation. You right? So what are you going to do? Day 16 downwards. What are you going to do? So the fertile window will start from day 11. Day 11, 12, 13, 14, 15, 16. Yeah. So when are you supposed to plan to knock waiting no good? When are you supposed to? Tell me. When are you supposed to knock with no good? Tell me. I want to know. Yeah. Right. Street character said 14. Day 14. Yes, because that is the best test of the days, right? Of course, but you can start knocking waiting no good from 11. Is that okay? But the best test of the day is the 14. All right. So if you are still here and you're understanding anything, please talk to me in the comment section. Write understand so that I will know that you are there, right? Is that okay? Just talk to me. Talk to me. I'm waiting for you. Talk to me. All right. So if you're seeing me for the first time, the first thing you want to do is to follow me. Make sure you follow me. And if you are trying to conceive, is the more reason why you should follow me. Is the more reason why. Don't worry. Time will tell, or rather, time will prove why you should follow me. Is that okay? So let's be followed. Now there is a method called the shortest longest cycle method. Who has heard it before? Just give me a wave in the comment section. Shortest longest cycle method. First time here. Good to see Lizzie Andy. Okay. Good. I'm gonna follow you back. As soon as the live stream ends, right? Right. So the longest, shortest cycle method. Who has heard this before? If you have not heard it, you've got to pay me. You've got to pay me for this, right? You've got to pay. Oh boy, you are in for some good information, I tell you. You are in for some good information. By the time this live stream ends, your life will never be the same again, right? Right? So are we ready? Let's talk about shortest, longest cycle method. I'm sure by tomorrow, when you start talking to people about this thing, you say, where did you go? Say, relax. This journey don't pass any medical school. They go shock now. Right? All right, let's talk about the shortest, longest cycle method. Right now, this you can use for women with slightly variable cycle, and that can be really confusing. Okay, when is my cycle? When is my cycle? Thank you very much. Thank you very much, Bobolowo. Where have you been? Where have you been? US Alima, I see you. Right. So the shortest, longest cycle method for women with slightly variable cycles. You want to use this method, and to work like magic, right? It work like magic. So your days of confusion will be over. So let's, of course, step by step. The reason why I put it step by step so that you can always catch and learn. Is that okay? So what you want to do in this shortest, longest cycle method is, the first step is you want to record your cycle for 6 months. By the way, I just mentioned 6 months. I've told people over and over again, if you are in a hurry to conceive tomorrow, you are not supposed to be in this live stream. This live stream is for people who are patient, who are willing to be educated, who are willing to follow the process, who are willing to get the results accurately. But if you want one drug that will solve all the problems, I don't have it. But I will guide you to all the process, including the treatment, so that you can work with your doctor and you get your result. Is that okay? So what you do in the first step is you want to record your cycle for 6 months, right? For example, the you record January, it was 27 days. You record February, it's 29 days. You record March, it is 28 days. You record April, it is 30 days. You record May, it is 27 days. You record June, it is 29 days. So you can see all this is so variable, really confusing. Really confusing. But remember, the goal is to know the ovulation day and you can extrapolate the fertile window, right? Now, when you have all this information, by the way, while you are doing this, it does not mean that you will stop trying. While you are doing that, you can even conceive and move on with your life. But this is just the best thing to do. Peradventure, nothing happens before then, right? So now what you do after making all those recordings, you take out the shortest cycle. And the shortest cycle in these 6 months is 27-day cycle. The longest cycle in the 6 months record is 30-day cycle, right? Then that leads us to step 2. I'm trying to be slow so that we'll catch up and catch on, right? Step 2. Step 2, you're going to apply a formula. I tell you, if you are not writing something, you're going to miss a lot. But no, don't worry. Go to YouTube. I'll drop it there. Dr. Gordon EMB. Make sure you subscribe, please. Subscribe so that we can grow there and help more people. Is that okay? So the step 2 in this shortest, longest cycle method, you want to apply this formula. The formula, what we'll do is we'll look at the first fertile day, right? So take out the shortest cycle. What is the shortest cycle? 27 days minus 18 is a constant, right? Minus 18. So 27 minus 18 is day 9. That is the fertile day, right? Then you take out the last fertile day, which is 30 days, minus 11. So 30 minus 11, that is 19. So the first fertile window is, or rather not the first fertile window, the fertile window in these variable cycles that you've had. I haven't calculated it like this. The fertile window will be from day 9 to day 19. So you have a 10 days window. This is a wider window, but it's safer for you to use to time intercourse. Understood? If you understand anything, just type understand. If you don't understand, say I beg, repeat. Right? And this one, I will repeat it because I know some people are just confused. And this one is regular now. It's regular unless the remaining few months have changes, then it's fine. Okay, street character confused. The confuse and understand will be the majority will carry the day. So I've seen one confuse, I've seen one understand. So majority will carry the day. If confuse are more, I will repeat it. If understand is more, I will move on. I want to talk about team irregular cycle. Irregular cycle people, come closer. I'm getting there. Are we there? All right, I will. Please help me, October. Calm down now. Calm down. Mercy, are you following me? Are you following me? Just make sure you follow me. That's the best thing for you to do. All right, I'm going to repeat it because street character is a subscriber. So all subscribers can ask me anything and I'm going to do for them. If you say I come to your house and back you, my back like this, and be running to the clinic, I will be there for you. All right. So I said step 2 in this longest shortest method. You want to apply this formula. Keep it in your diary. Keep it in your diary. Remember, you've taken all the variable cycle days in the past 6 months, like this person has been giving me in the comment section, right? So what you want to do, do a calculation of the shortest cycle, right? And do a calculation of the longest cycle. So what you do with the shortest cycle, you minus 18 from the shortest cycle, right? When you minus 18 from the shortest cycle, whatever you get, the day you get, hold on to that one, that is shortest cycle. Then you go to the longest cycle, minus 11 from the longest cycle, right? Whatever you get, hold on to it. So what you got in the shortest cycle and what you got in the longest cycle will form the fertile window for this variable menstrual duration, right? So that's what so you can use you can start taking notes. Like this person that's given me 3 months already. So just keep taking notes, then use these methods. And well, if you did not remember, you can always go to YouTube, you hear it again, and it will help you. Is that okay? So use your own. Maybe your own is 31 days, 35 days, 28 days, 21 days. So regardless, it's still the same method you can use all together, right? So this is for team regular that have slight variable duration. So let us now talk about my people. Team irregular cycle, come closer. Team irregular, come. Tiglis is here. Good evening, Tiglis. Good to see you. Thank you for joining. Thank you for joining. Right? So, team irregular cycle, come closer. Why the irregular people, please go back. Let me talk to my people. Team irregular cycle. Good evening, team. I said team. Tiglis, you're welcome. Good evening. Good to see you. So we are discussing tracking ovulation, and we have been doing a lot of calculations. Today, people head will scatter for calculation. When I don't enter, right? We will calculate because this pregnancy we will carry on, right? So let's talk about how to calculate ovulation for irregular cycle. Who is ready? Please, if you are ready, just type ready in the comment section. Let me be sure that I have a team irregular cycle. Team irregular, talk to me now. Talk to me. If no team irregular, we'll just jump it and go somewhere else. All right? But I will not jump it. I'm not like that. The math you have been dodging in school, you don't see Wahala today. All right. So the reason why I will not jump this one, even though there's no team irregular, is because the information will be valuable to somebody else through you, right? So if you learn it, you can always go at somebody else, right? But if you don't learn them, come to the clinic, you pay consultation, then we'll talk. Is that okay? Like those people who come to these TTC people, they are not serious. Some of them, not all of them. Some of them are not serious. All right, let's talk about irregular cycle. And what does irregular cycle mean anyway? What does it mean? Irregular cycle. is defined as a cycle length that varies more than 7 to 10 days. Listen, listen. Remember, we talk about variation in the regular, and the variation in regular is anywhere from 5 to 7 days. So no big deal if the changes across the month is just small, small, small. We're able to do that calculation. But now, irregular cycle means that your cycle length changes across the month more than 7 to 10 days. More than 7 to 10 days. Right? You have missing periods and even unpredictable timing. This self don't tire you. Welcome to my world. Right? And what are the common causes? What are the common causes of irregular cycle? The common causes include, I hope the person that asked about PCOS, I hope you are still here. If you are not here, I can help you. Right? The common causes of irregular cycle, PCOS is one. Thyroid disorder, stress, extreme weight gain, and hormonal imbalance. In irregular cycle, calendar methods are unreliable. Right? Good evening, Achievers T is here. How can you come late, Achievers T, when I'm talking about your case? Achievers T, what can we do for you? All right, it's okay. So I was saying that in irregular cycles, calendar methods alone are not reliable. Calendar methods alone are not reliable. Please tap on your screen. Let's tap on our screen, please. Peculiar, you're a late comer. Why did you come late? Don't worry. Go to YouTube. I'll drop it there in YouTube. Type my name, Dr. Godwin EMB, so you can catch the full live stream there. Is that okay? No, you'll not miss anything. But just please try to subscribe on YouTube. Just tap the subscribe button. Right? Thank you very much, Peculiar. I appreciate you. So what did I say? I said, good evening, Ayola. Good to see you. I said in irregular cycles, calendar methods alone are not reliable. However, some calculation strategy can still help. So who is ready for the strategy? I just gave us one strategy just now. So who is ready for this irregular cycle strategy? Oh boy, so much to learn. I think by the time we are done today, tomorrow, some people said we'll be heavy like this. You've learned so much. You've learned so much. Right? Who's ready? Is it the network or nobody's ready? Nobody's ready. Okay. Who is ready? Who is ready? Who is ready? Ready. So in the irregular cycle, let's take the first method. Right? The first method is the wide window approach. The wide window approach. If your cycle changes widely, right? If your cycle changes widely, the difference is wide. Assuming ovulation occurs anywhere between day 10 and day 21, The recommended approach would be you want to have intercourse every 2 to 3 days from day 8 to day 22. Team Irregular, are you here and are you listening to me? Ayola, you come up and ask that question when we are ready, right? Don't go anywhere. I need to answer that question. Is that okay? Team Irregular Cycle, are you here and are you listening to me? If you're not here, now you know. So what did I say? If your cycle vary widely, assuming assuming ovulation, just assuming that ovulation occur between day 10 and day 21, right? Just assuming day 10, 21 in between is when ovulation occurs. You are not sure. So what is the recommended approach if you are trying to conceive? You want to have intercourse every 2 to 3 days from day 8 to day 22. Thank you very much, T. Glees. Thank you very much. The reason why you want to do that is to ensure that sperm are present whenever ovulation takes place. It's so wide. The window is so wide. So you don't know exactly which day in this wide window ovulation will take place. So what do? You supply the system with enough sperm so that any day fertilization take place, any day ovulation take place, fertilization will occur, right? So that's the reason for this approach. That is the first method for team irregular cycle. The second method for team irregular cycle, the second method would be long-term cycle tracking. Long-term cycle tracking. This one, you have to be patient. No be me say make your cycle day irregular. No, so no vex with me. So you need to be patient. For example, remember what we did in the other regular where we were counting days, right? You will follow that day. You have to follow it because trying to conceive is a painstaking, intentional approach. No guesswork. Is that you're doing it right or you're not doing it right? Is that you want to do it or you don't want to do it? Make everybody go rest, right? So now let's go back and look at this. Let's take example. Let's take some data, right? Right. So you are counting. You are tracking your cycle for between 6 to 12 months, right? For those who want it sharp, 6 months is still the time. It's not going to be shorter than that. You're going to be taking note. When did the rather how long is the cycle? Month by month. Get a diary and be writing it. So let's take a data for the team irregular. We've done for regular. So let's take for team irregular. So let's assume January to June, right? What do we do? January cycle length 32 days. February cycle length 45 days. March cycle length 28 days. The other month after March, April 50 days. The month after that 34 days. The month after that, that's June, 40 days. This kind of cycle is confusing. Even myself, it's entire. But we already know what to do, right? We already know what to do. Those of you who have been here, you know what to do already? Right. So let's talk about it. We already know what to do. So what do? Identify the shortest cycle. Identify the shortest cycle. And what is the shortest cycle in this recorded data? The shortest cycle among them is 28-day cycle. So you take it down, 28-day. They identify the longest cycle, right? It's actually Jaga Jaga cycle. It's a Jaga Jaga, but we have solution to Jaga Jaga cycle. You see, that's why I beg people, don't miss the live stream. We may just be talking about your case the day you will not be around, right? So I'm just thinking about all those people who have been asking about irregular cycle, and they are not here today. Anyway, there's YouTube. We'll drop it in YouTube. Go and check it out. Right. So the longest cycle in this data we collected in the past 6 months is 50 days cycle. So what do we do? So let's continue. So the shortest of the cycle you've taken in the data was 28-day cycle. You take the longest, which is 50 days. So now apply what we already know, right? Remember the formula? What do you do? The shortest, 28 minus 18, gives you what? Day 10, right? The longest, the longest is 50 rather. 50 minus 11 gives you what? Day 39. So the fertile window will be within the brackets of 10, day 10 to 39. That's very wide. In this case, what you really need will be ovulation tracking, which will be more practical, right? You want to go for a folliculometry, right? That will help you better. But that is basically how to calculate it and know. Is that okay? So I'm sure your doctor, your gynae will guide you. Or at least you know now. All right. So I will said that. Let's move on to other things. If you're just joining, you're welcome. And if you want to go and sleep, please go and sleep. Because this matter will finish it today. All right. Let's talk about physical signs of ovulation. At least this one, it does not include calculation again. So I know some people are already running away. I don't want to calculate anything. Let's deal with physical signs of ovulation. You know the good thing? The good thing is that the body often provides clues when ovulation is near. The body does not leave you in the dark, right? The body will always do that. That's the beautiful thing. So let's look at those clues. Let's look at a few of them. Is that okay? The first one is cervical mucus change. In fact, I think every woman should know this one. But if you don't know, you're in the right place. Cervical mucus change. And this is one of the most reliable natural signs. Unless you get infection. Yeah? When you confuse your life. Right? The cervical mucus change is the most reliable natural sign. Here, when you're at your non-fertile phase, the mucus here is dry and sticky. You are not close to fertility in any way. The fertile phase is far away, right? But when you are approaching ovulation, the mucus begin to change to creamy or lotion-like mucus, right? When you are at your peak fertility, This is what the cervical mucus will look like. It look clear, stretchy, slippery, and it looks like raw egg white. And voila, I'm at the peak of my fertility. You just know this thing at the tip of your fingers and use it accordingly. This type of mucus will help sperm. This clear, stretchy, slippery, raw egg white. Greetings, Mrs. Polite. I see you. Right? When the mucus becomes like that, it helps the sperm to travel easily. Because if the mucus is thick or sticky, it traps sperm from traveling. But when it's close to, or if at the peak of fertility and it changes like that, sperm finds their way and run through the cervix, right? So you just know that, man, I'm in my peak of fertility and I'm going to take advantage, right? Right. So when you see this, ovulation usually would occur within 1 to 2 days of this peak mucus. I'm talking to my TTC people, those that are trying to conceive. It's important you know this, so that you don't go and be knocking all over the place. You don't know exactly what's going on. Understand these things from the calculation now to the physical science, right? So when you see this raw egg, white, slippery, stretchy, clear mucus, is a pointer that within 1 or 2 days, ovulation will happen. Is that okay? Thank you very much, Mrs. Polite. I appreciate you. Is that okay? If you understood up to this point, please type in the comment section understood, so that we'll move on to the next thing. I don't want to leave anybody in the dark, right? Understood? But if you are just coming, don't say anything, so that I'm talking to people who have been here, right? Now, the other one, physical sign, is ovulation pain, right? Because some women feel this mild. You are just coming, okay, just continue. Miss Polite, continue from where you join us. Well, go to YouTube, Dr. Godwin EMB on YouTube. This whole episode will be dropped there, so you really will not miss anything. Is that okay? Well, please don't forget to subscribe, so that we can grow there and help more people, right? So I was talking about ovulation pain, right? Some women feel this mild pain on one side. Listen. It's important you understand what I'm saying, right? Because one of the major challenges I have with patients, they just run away with information without really understanding it, right? So listen. Ovulation pain as one of the physical signs of ovulation, right? What you have is mild pain on one side of your lower abdomen. Usually that will occur around your ovulation. And I will tell you why that happens. That pain you feel. In fact, Oyibo people call it Mittelsmash. I think it's a German name. I don't know why Oyibo people like putting their name on things. Called Mittelsmash. I hope that's the right pronunciation. Right? Now, the reason why you feel that pain, called ovulation pain, is because of the rupture that happens. Ayola, I said, wait, I'm going to answer your question when it's time for question. This one I will answer. All right? I will answer it. Yes, street character. Like something bites. Some people feel a sharp, sudden pain. Right? So it's actually because of the rupture of the follicle. Remember, the follicle will mature until the day of ovulation. Then when it's day of ovulation, the follicle will rupture. The reason for the rupture is to allow the egg, mature egg, to escape into the fallopian tube. Now, when that rupture happens, there is spilling of fluid and blood. So that irritation is what is causing that pain, right? So the irritation from the blood and fluid, that is what is causing the pain. Is it understood? Is it understood? Ovulation pain, meatus smirch. Did you understand that? I just dramatize in my head to somebody who is trying to conceive. You just walking on the street and just it's ovulation pain. You just run, go house, go knock. that is weird. that, that is not right. Don't put yourself under pressure. Don't put yourself under pressure. Just do the right thing. Is that okay? So if this one does not work for you, the other one will work. Is that okay? So ovulation pain. All right. Another physical sign of ovulation. Yeah. Breast tenderness. Breast tenderness. See, I'm touching my own as if I have it. I don't have it. I beg. Right? Breast tenderness. Yeah. Now, after ovulation occurs, yeah, after ovulation occurs, one thing that will definitely happen is the rise of progesterone. Right? Of course, progesterone does many things, which I explained in the first season. I'll still do that in time to come, but just stay with me on this episode. Is that okay? So, right, progesterone rises, breasts may feel fuller and tender. Right? Fuller and tender. Because if that is a sign that ovulation has happened. Yeah, that is the hormonal changes that happen because ovulation occurred will cause breast fullness and tenderness. Some will say it's their nipple that is paining them and stuff. Is that clear? Let's move on to the next thing. Oh, the next physical sign of ovulation is what they abbreviate to be, hello, Bluesy. Good to see you. You're welcome. They abbreviate it to be BBT. BBT means basal body temperature. So BBT tracking. This one, you have to be painstaking also, right? You have to be painstaking also because BBT involves measuring body temperature. So what do you do? Every morning, you measure your temperature before getting out of bed. At the same time, and it has to be taken the same time every day, right? Now, after ovulation, the temperature will rise. Your body temperature, your basal body temperature will rise by 0.3 to 0.5 degrees centigrade and stay elevated until the next period. So, when you see that rise, ovulation has occurred, right? This confirms ovulation, right? However, it will not it does not predict the ovulation. Why? Because you see that rise when ovulation has already occurred, but your goal is to hit it when ovulation occurs, right? It only confirms the aftermath. Is that English? Okay, that's correct English. The aftermath of ovulation. So if you want to rely on this one, you may not hit the mark. Remember that when ovulation takes place, you only have 12 to 24 hours. So this will not be a best thing to use. Is that okay? Yeah. All right. Up until this point, if you understood anything, please just type understand in the comment section. Let me be sure I'm talking to people who are here and alive. Please tap on your screen. We are still at 19K. That's pretty small. Tap on your screen. Let's give some people more opportunities to come and learn something. All right. So tap on your screen, share the live. Then let's talk about ovulation prediction kits. OPK. I'm giving you all the ways to know or track your ovulation. All the ways to track your ovulation. This is very key because I want you to conceive before June. Before June. Well, if you listen to my videos, watch my videos, you go carry belly. If you don't want to conceive, don't watch those videos. Right? Because if you want to and do what we say, you carry. Because that is the purpose. That is the purpose. Is that okay? So let's talk about ovulation predictor kits, right? These are urine tests that detect the LH surge. So the urine kit will detect when LH has gone up, right? So that's basically how it works. So the LH surge, right, will happen. LH surge happens 24 to 36 hours before ovulation, right? Why? Because the LH needs to go up before the rupture, right? So this LH will be going up 24 hours to 36 hours before ovulation occurs. So that just gives you an idea. So you have between 1 to 2 days to take advantage of your ovulation if you are using the kit, right? So it signals the body to release egg. That's what LH does, right? So when the test turns positive, ovulation definitely will be expected within the next day. So you want to take advantage. So the best intercourse timing when you are using this method is the day of the positive tests. The day you saw that your LH kit, your OPK is positive. Go and knock waiting no good. And also knock waiting no good the following day. Then you get your result. So let's look at medical methods because I just gave you all the methods that are in your hands, right? So what about the methods that is in our hands? Medical methods, right? So let's take the first one. Who is ready for the medical method? Or I should just leave it till tomorrow? I'm not going to leave it because we don't have the time. Tomorrow we are supposed to talk about another important thing. So we're not going to leave it. If you are tired, go and sleep. Go to YouTube. The episode will be there. Right? Okay. I will fast track. All right. So the medical methods, the first one is follicular tracking ultrasound. Follicular tracking ultrasound. And this is the gold standard. This is the gold standard. Take advantage of follicular tracking ultrasound. Basically, the ultrasound will begin day 8 to day 10, right? The follicles will be measured. Then we'll identify the dominant follicle. The dominant follicle will be the one that is maturing above others, right? Now, ovulation usually occur when the follicle. So this is just to give you an understanding, so that when you have a chit chat with your doctor, you have an understanding of what they are telling you. Is that okay? Because some people And that's why I'm very angry with some of my TTC women here. After you have gone to the clinic, you didn't ask any questions, right? You even left them more confused. You come and ask me. I tell you to pay 5K for consultation. You say no. Well, you spend 100 and something K where they made you confused. Why are you people like this? Eh? They said it's not good to be good. And I've learned it in this place. All right. You're learning it for free, don't worry. You're learning for free. So, ovulation usually occurs when the follicle reach 18 to 24 mm. So when you do the scan and they measure the dominant follicle, the largest one, and it's anywhere, and you're hearing something like 18 to 24 mm, ovulation is imminent. In fact, before 24 hours elapse, it will ovulate, right? This scan, this follicular tracking scan, can predict ovulation for you. It can confirm ovulation for you. It can guide your timing of intercourse. So take advantage of it, especially for those who are really confused and you really cannot apply all the things I've said today. So you want to take advantage of follicular tracking scan. Is that okay? And God will bless you. Meet somebody who is so professional, somebody who is so experienced that will guide you correctly. Is that okay? So, for maximum pregnancy chances, this is the best intercourse strategy you can use. Yeah? For my team regular people, team regular, this is your best strategy. You want to have intercourse every 2 to 3 days and increase the frequency during the fertile window. You cannot say, okay, because in 15 days time, our fertile window will start. Therefore, I want to abstain. Make I regard that you want to be saving sperm like you are doing savings account. You cannot do that. Right? You cannot do that. Because the tendency for sperm is to grow weak as it stays longer. So that's why you're supposed to knack and get it refreshed every 2 to 3 days. Then when you hit your fertile window, knack waiting no good. Right? Is that okay? That's the way, that's the strategy. That's the strategy. Increase the frequency in your fertile window. Understood? Team regular. Did you understand? Let me be sure. Talk to me if you are in the comment section. Team regular, if you are there, talk to me. Because I want to talk to my team irregular also. It's only one team regular I have here. The others are spectators. Right? All right. All right. So if you miss anything, go to YouTube. Dr. Godwin EMB is the name. Subscribe there, please. Let us grow that place and help more people. Is that okay? Now for team irregular, what I mean by regular is regular cycle. Team irregular means team irregular cycle, right? So the intercourse strategy, the knacking strategy for team irregular, you want to have intercourse every 2 to 3 days throughout your cycle. This will ensure sperm is present whenever ovulation takes place. Because it's irregular and you are so confused about when the ovulation is taking place, So you want to make sure there is a constant supply of sperm in your uterine tract whenever the ovulation takes place. Is that okay? Is that a strategy you can do? It's not difficult. I like giving the easiest method so that we'll come out with a positive result. Right? Are we okay? Are we okay? Talk to me in the comment section. Good strategy. Thank you. Thank you very much. Now, after saying all these wonderful things, there are common mistakes in ovulation tracking. Person go tire for knacking. you go knack now, you go tire. Maybe when you were still young, your blood dey hot. Say, if I marry, I go knack wetin no good. Now you don't marry, you don't dey run. When I see young people, their blood dey hot. Don't worry, you come on this side, you understand. You think marriage is all about knacking. Some of them say they need even to see the knacking. Right? So where was I in this gist? I was going to say, oh yes, I was talking about common mistakes in ovulation tracking. All right? Common mistakes in ovulation tracking. Mistake number 1, where you assume ovulation always happen on day 14. If you started from the beginning of this live stream, you already know that is not true. That's mistake number 1. Mistake number 2, where you rely only on apps without your body's sign. That's mistake number 2. Your apps are good. Use them. But remember, these are applications that are designed on assumptions. Right? So while you are using it, also look at your body. I told you the physical signs you can use to monitor ovulation in your body. Right? So be smart. The reason for this detailed information is so that you can do it yourself at home. Right? And if you never understand, you still go and meet a doctor. If you don't feel catch and free, you still go and pay for it. All right. So whichever way, you will not lose. Right? Mistake number 3. Having intercourse only after ovulation. That is a wrong idea. It's okay because I've ovulated, then the egg is available. Wrong. After ovulation, the egg is only available 12 to 24 hours. And that's not a smart way to have intercourse. It's not a smart way. All right? So you cannot be having intercourse only after ovulation. You're more less likely to conceive using that strategy. Right? Another mistake is some people stop having intercourse early. Right? For whatever reason, I don't know. They stop having intercourse early. So please use the timing, use the calculation, use the signs that we gave you today. Right? Use all the strategies. If one didn't work for you, the other one should work. Is that okay? And the worst of all the mistake is where you don't track your cycle consistently. Whether you are a team regular cycle or team irregular cycle, make sure you know how to track your cycle consistently. Is that okay? So that's the way to go. Couples, couples timing intercourse during the fertile window have 20 to 30% chance of getting pregnant per cycle. I'll need to see the whole results. Who is that? Who has that question? Precious. I'll need to see the whole results. Right? So I said couples timing intercourse during their fertile window have 20 to 30% chance per cycle. And that's the best chance you have, right? So those who don't time, they have a chance below 10% per cycle, right? The smart thing is when you time correctly, you actually double your chances of conception, right? If there is another problem, we are going to work with you to deal with it. That's why I urge you, don't miss the live stream. There are several things we've said from day one, from January 1st up until now. So you want to go to YouTube and learn those things. Don't miss the information because every day comes with new things you need to learn. All right, before I take questions, I just want to quickly refresh our minds, right? Please, ovulation is the central event of the fertility cycle. You can send me results on contact me on my DM. Of course, you'll pay 5K consultation fee for private consultation, right? So chat me on my DM, then I'll send you my green app. Is that okay? So that's how you can consult. You can contact me. Where was I? I was saying that ovulation is the central event in fertility cycle. The fertile window only lasts 6 days. Only 6 days. It's not every day that you have fertile window. Only 6 days of your cycle. Ovulation occurs about 14 days before the next cycle. If you missed it before, I'm saying it again. This is a recap I'm doing before I take questions and we all go away. Right? Ovulation occurs about 14 days before the next cycle. Right? Regular cycle allows easier prediction. So team regular people, it's easy for us to calculate your fertile window and ovulation. But team irregular, at least we've done the maths today, you now understand. So, but if you are still in confusion, talk to me. Let's work together. I'm always available. If you are trying to conceive and you're serious, I'm always available to you, right? Until you carry, we will not let you rest. Right? We'll not let you rest. I say to this year, we'll push, some people will push them until they conceive. Right? We'll push some people into conception. You go carry this belly this year. Right? So now irregular cycle will require a wider timing. So you have to be smart. Remember, we've done the maths. So either you are using the mathematics for a wider timing or you use a medical tracking like ultrasound tracking, OPKs, that's your kits. All right. Use a BBT method, which is less for me, but you can use that. And others I mentioned, and the other one for testing, right? Be smart, take advantage of it. Long story short, ultrasound tracking is the most accurate method. So, my dearest friends, those trying to conceive, many couples are not infertile. I say this with full chest. Many couples are not infertile. They are just simply mistiming their intercourse because of ignorance. Right? Ovulation tracking transforms fertility from guesswork into a calculated biological process. And once timing becomes precise, the chance of pregnancy often improve dramatically. Long story short, infertility, knowing your fertile window can change your outcome. And if we look at you and we discover that there's really a problem, we will advise you on the treatment or go for your ART treatment, right? But most of the people who are struggling, it's just lack of knowledge. But we're here to help you. God bless you.